Why measure implant stability and marginal bone height? But primary stability may indicate potential failure if that stability is too low, and it may be a marker and identifier for suitable for loading and also the optimal healing period. This was 20 years ago. Secondary stability indicates the level of osseointegration, potential load capacity and complications. And we can monitor stiffness and bone height to avoid overloading with time. And this was then, and we are still in a situation where patients and surgeons and clinicians would like to have implants placed and immediately loaded, but there is a risk, and there are risks in doing this, and the way is to identify that risks. We're also aware that there are a number of potential test methods for testing implants, and these at that time, and really remain pretty much the same, is an insertion torque, is measure the insertion resistance, which I'm going to touch on for a minute, Perrier test, which is a percussion test, and that's been around for a long time. We'll look at that very briefly, transient impact and radiographs. So insertion torque used to be pretty much a standardized technique. So implants were pre-tapped with a tap before an implant placed. Now, almost 99% of implants are placed and tapped at the same time. The implant characteristics, the thread characteristics are cutting, and they cut the bone. With that comes some issues and some discussion. The Perrier test was an instrument designed by Siemens to measure tooth mobility. They took an algorithm based on a very large range of measurements from the University of Frankfurt of the range of tooth mobility in relation to support, and built a scale of -5 to +50 for tooth mobility. It was obvious to apply it and try it with dental implants. But the challenge has been is that range of mobility for a tooth, a compromised tooth under periodontal concerns, is very, very different. The profile is very different to that of an implant, and that's been something of a challenge. Unfortunately, with radiographs, radiographic changes take time to be able to be evident and visible, and very often in that time, things have failed. Another test method was the transient impact testing, and one or two people have tried to be able to develop. This was the dental fine test, or a little percussion test. This was one of the early days of the Perrier test. So there are test methods that have been used. Quite a lot of work was done on insertion torque and cutting torque to understand, and Bertel Freeberg did a lot of work with Lars Seneby to look at cutting resistance and to see if it could be used in a way to predict implant outcome, and to look at the range of bone qualities at different levels during insertion. One of the challenges with insertion torque is understanding and trying to identify what to measure when an implant is inserted. Is this the slope of this graph? Is it the peak of the graph? Is it the area under the graph? It's tricky, and it is tricky to resolve it. I'm not saying it's not possible, but what we see is that insertion torque is influenced by a lot of different parameters. It's influenced by the force of thread cutting, by the amount of bone that's cut, by the friction, the shape and geometry of the implant, and the size of the drill. And we have very good evidence to support this. This was done by one of my PhD students, who simply showed the smaller the final drill, the higher the insertion torque when you place an implant. And that's to be expected. But it is not a measurement of stability. That is important. And we can see this, and we can see the difference. It is possible to resolve insertion torque parameters, but you need to be able to input a range of information, including implant characteristics, design, size, and type, in order to get meaningful data out of it.